While a number of European countries imposed new restrictions, life in London seemed to have been almost untouched by the pandemic recently. On the banks of the Thames, people carelessly drank their mulled wine, performances were running at full capacity in the theatres, and friends across town met in the pubs for a beer or two. On Saturday, the British Prime Minister Boris Johnson announced new measures because of the new coronavirus variant Omikron. 2 cases of infection with the variant had previously been confirmed in England. The country has already had 3 lockdowns. Almost 145,000 people have died after being infected with the coronavirus. Only in Europe are there more victims to mourn. The particularly contagious Delta variant had ravaged Great Britain in the summer, at a time when the government had decided to withdraw almost all restrictions to contain the pandemic. The rest of Europe was only hit by this virus variant after a certain delay. Perhaps the country was lucky in misfortune, because the Delta variant reached Great Britain in the summer months when respiratory viruses would spread less easily. The development was not as explosive as it is currently in some other European countries, says, for example, Marc, an expert in modeling infectious diseases from the University of Edinburgh. He says, the United Kingdom got its Delta wave at a favorable time, while in the case of Austria, for example, it was exactly the other way round. The World Health Organization, the WHO, said this week that Europe is the only region in the world where the number of corona cases is still rising, and that another 700,000 people could die there by spring if urgent measures are not taken soon. Unlike a few months ago, the warnings did not apply so much to Great Britain this time. Many scientists had predicted that after July 19th, the famous Freedom Day, when almost all restrictions on everyday life were lifted, Britain would see a dramatic increase in the number of infections. But the catastrophe did not materialize. The country still records around 40,000 infections every day, but thanks to a relatively high vaccination rate, there are not as many serious disease causes and deaths as during the previous waves. It's still too early to give the all clear. In the past week, around 130 people died with the coronavirus every day in Great Britain. The hospitals are not overloaded, but they are busy. And just in the past few days, it has once again been shown to what extent the pandemic can cause nasty surprises. On Friday, Great Britain and several other countries cancelled flights from South Africa because a new virus variation is on the rise there and is considered to be even more dangerous than the previous ones. So, to slow the spread, it is necessary to take targeted and preventive measures, said Johnson. And he said, right now, that's the responsible approach. Anyone arriving in England from abroad must undergo a PCR test on the 2nd day after arrival. Should someone test positive for the Omicron variant, close contacts would have to go into self-isolation for 10 days, regardless of the vaccination status. Most recently, people infected with coronavirus did not have to go into quarantine if they were fully vaccinated. As Johnson said, masks must be worn in shops and on public transport. A group of scientists advising the government had been instructed to advance the vaccination program. From today, we will boost the booster campaign, said Johnson. Well, when it comes to vaccination, London wants to continue to rely on voluntariness, while in more and more European countries the option of mandatory vaccinations is being brought into play. The same here in Germany. For some time now, immunization has only been mandatory in sensitive areas such as healthcare. Meanwhile, social resistance to vaccination seems to be lower than elsewhere. 88% of Britons over the age of 12 have already at least had one injection, and Johnson this week encouraged his compatriots to get a boosted dose as soon as possible. And it seems to be like this, that it's different people in different cities or whatever. In my city, the rate of those over 12 is even 92%, but we have 50,000 university students here in my city and a lot of people in a public office, so to speak. And I'll see you in my next video. Bis gleich.